Hi everyone, I'm Deepshikha, and today I'm going to be a host for the InnoHealth magazine podcast. We have with us Dr. Pushkar Kumar today. So for our listeners, would you please give us a brief introduction about yourself?
Hi, good afternoon everyone. I'm Dr. Pushkar Kumar. I'm a physician, a pathologist and a public health professional, having worked for the last 20 years in the field of public health at the Apollo Hospitals, Delhi, in the ministry at NACO and Maternal Health Division of Ministry of Health. And for the last 9 years, I've been a part of Public Health Foundation of India. I head the training unit as a director of training at PHFI.
Thank you so much, sir. We're so honored to have you here with us today. We are all very intrigued. As a public health enthusiast, I'm also very intrigued. So initially, I just want to know, how are you resonating with the whole theme of InnoHealth conference this year?
Innovations is a part of not only health. Innovations, if in the current world, if you have to go ahead, progress, innovations have to be there. And healthcare is one area where innovations is definitely a part. I've been associated with InnoHealth for the past, I think, 3 to 4 years when it was started at the IIIT, as well as with Innovatio Curis. I've been attending the conferences, working with them. And at least it addresses new themes, new areas, which every healthcare personnel should be a part of, because medicine is advancing, and unless technology is used judiciously, both for patient care, also for even the basic facilities from billing to getting counseling services to record keeping, definitely this InnoHealth as well as innovations have to be a part, definitely.
So, as we all know that innovations need to be happening, and they are taking great strides, especially with Innovatio Curis. So since you are somebody who works with training and capacity level of public health workers and experts, where do you think AI is seeping into, especially at the grassroots level, and how confident do public health experts feel themselves, and to what extent AI will go as of now?
AI has definitely advanced. Being a medical professional, doctors, many times I feel maybe it's getting too much into even the day-to-day working, where even a mobile or laptops are sometimes being hard on us. But this is a need of the hour as well, whether it is into capacity building or even to reach out when you go to the rural areas, to far reach. So AI has made a dent where accessibility can be tackled. You can have better record keeping, more innovations, follow-ups. So definitely AI can help in that. And capacity building is one area, not only in creating curriculums, in teaching. Post-pandemic, it has definitely impacted where a physical meeting, when was not possible for at least a year or year and a half, did help to reach out to a larger audience at much lower cost. And we continue to use this technology in our day-to-day lives, not only as a capacity building, as a lead for this, but I think different people, different healthcare professionals and the governments are using it day in and out.
So somebody who's working very closely with many models and sustainable strategies in, basically training public health experts to address the grassroots problems. What are some strategies that you have come across work best for people who are trying to learn and integrate that when they go into the field?
Basically, this is also, I'll say, very advancing. Since I worked around 10 years in the government of India, that was a time where we did not have to worry about funding, and it was more of expenditure where the government, the states had to spend. But since the last 9 years when I've been into the NGO sector, funding as well as sustainability becomes a major issue. To run anything, funds are needed for each and every activity. But technology increases the reach. If you start with a small scale, you can reach large numbers. And a value addition is definitely, if something you are doing with a quality centered mind, and you add a lot of value, robustness, record keeping, data, it will reach to more people. And even with a less amount of funds, you will require some funds to run any program, whether it's capacity or anything. But a small amount of funds, every individual is able to use. Giving an example, every person is using a metro to a toffee or a cigarette which is a wasteful. But if we use those small amounts, we try to save them and use it for healthcare needs, we can go a long way. So sustainability, you have to look for sustainability without a funding or with a funding, and see how much you want to take it forward. So running, just an example, another I'll add in my own areas, running training programs, we are trying to use a lot of technology where we can reach at many centers at a very low cost, where a large number of physicians we are able to train in an online mode where they don't have to spend in coming to a training center, a medical hall or a teaching room. They can run from their homes on Sundays with a lower cost. So it becomes much more feasible, a small amount of fees which a doctor or a nurse or whomever we are training, they are able to, and we are able to run a lot of training programs with that, and we are doing that pan-India at PHFI.
Wow, well that's great to know. Public health experts like you and basically healthcare experts like you, we're making great strides in healthcare, and that's all thanks to experts like him. And we're so happy to be here. We're all just a part of the process till healthcare is able to reach each and every needy and underserved people in areas. Thank you for your presence, sir.
Thanks,
we had a great time chatting with you.
Thanks the team. Thank you.
Thank you so much.
Thank you.